means that in the middle of the disc, there's a jelly-like material that is very inflammatory. And when the disc degenerates and the rim ruptures, the inner part can be sort of come out like a jelly-like material. And the problem with that is that anything that it touches, it will inflame. So if the ligaments in this area, the nerves that come out of the spine, that can also be inflamed from that disc material being in contact with it and lead you to have pain. Disc herniation can be caused by, repetitive movements like bending at the waist, heavy lifting, and twisting. Knees gets a lot of arthritis, but the joints in the spine also get arthritis. And the joints in the spine are called facet joints. And they also are joints that have cartilages, just like the knees. And those joints are also susceptible to arthritic and osteoarthritic changes from wear and tear. Usually what happens is you have degeneration of the discs. That puts more pressure on the joints. The joints start to degenerate or become arthritic, and you can have pain due to that. Mechanical and neurogenic pain can also be caused by a condition called spondylolisthesis. That means that as your disc and joints degenerate, there's more movement along the ligaments and on the spine. And that can lead to a slippage of one vertebral body, which is this. This is a vertebra. This is another vertebra. This is the disc. This is a nerve root coming out from this tunnel, which is called the foramen. And as you can see here, the vertebrae are supposed to be stacked together, one on top of the other. But there's been a slippage here of this vertebra on top above this disc, and the rest below had remained in place. And when that happens, that can also lead to inflammatory changes, compression of nerves or the spinal cord, and lead to back pain. Lumbar stenosis. Have anybody of you used that, heard that term before, spinal stenosis or lumbar stenosis? I'm sure you have heard that term thrown around. Well, what happens with spinal stenosis or lumbar stenosis is that the canal, the bony canal around the spinal cord has become smaller. And that can lead to constant or intermittent pressure on the spinal cord, which is this in this cartoon, or the nerve roots, the nerves that come out of the spine. Usually, people with spinal stenosis have what I call the shopping cart sign. They like to go shopping, but they like to lean on the cart, because what that does is that relieves the pressure on the spinal cord by opening the canal a little bit more, because it separates these bones, make them farther apart, and you get a little break from the pain. Foraminal stenosis is another type of stenosis, but instead of being along the main bony canal that surrounds the spinal cord, is a narrowing of this tunnel called the foramen, where the nerve roots comes out. And what happens is that as you pinch that nerve, you can have pain on the back, pain on the leg, or on both. And that narrowing can be due, again, to the changes that happen on the discs, on the facet joints, and bony spurs that grow, because as your joints degenerate and they're more lax, then you can have bony overgrowth that can pinch on either the spinal cord or, in this case, the nerve roots. How is the diagnosis made? If you ever need a pain specialist and he just spends 2 minutes with you and barely touch you, just get a second opinion. You can't make a diagnosis without a complete history and physical, okay? After the doctor does a complete history and physical, he will send you for radiologic studies, usually some x-rays of the spine, and depending on what that shows, MRI of the spine, and blood test. Your doctor, as I mentioned, he doesn't want to miss that you have a cancer or an infection, so some blood tests will be sent at the time. if he thinks that it's indicated. What can we do to relieve pain? Well, there is non-surgical treatments, and usually most doctors try to work from the least invasive to the more invasive treatments. Bed rest. In the past, if you had back pain, they said, oh, spend 1 month in bed. We no longer advocate that, because what happens with that, when you get off that bed, you'll have more pain because of muscle atrophy. So the recommended is no more than 2 weeks, and usually a couple of days. A back brace can be used if your pain is not too severe. Again, only no more than a week, and usually the reason not to have it long term is because if you depend only on the back brace for support, your muscles around the spine are going to atrophy. So then you're going to get weakened and you're going to have more pain. But for a short time, a back brace can help just get the pressure off some of the joints from the spine. Medications, and that include not only the anti-inflammatories that Dr. Stewart mentioned, but also opioids, nerve or neuropathic analgesic, which is special kind of medications for nerve pain. And physical therapy and exercise is very important. You know, basically that is what is going to do most of the work, and it's part of the